Hello, my name is Madi. Today I am going to be doing the intramuscular injection now. So, first things first, I'm going to go ahead and read out the 6 rights of medication. We have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Okay, and then next I'm going to go ahead and I have to do this 3 times. I have to go ahead and make sure that I have the correct medication. So the order reads morphine 6 milligrams intramuscular 1 time, but on hand we have 4 milligrams per ml. And in order to get the correct milliliters, I would divide 6 by 4, and then I get 1.5. So it's going to be 1.5 milligram mLs that I'm using per 4 milligrams. Okay, and then I'm gonna go ahead and make sure I have the correct syringe, which is 3 ml. I have the correct needle, which is going to be 25 gauge 1 inch. Typically, if the patient is a little bit larger, you would use like 1.5 inches. But my patient is not that large. I have some gauze, I have a band-aid just in case, and I also have alcohol prep pads and my gloves. And then I'm gonna go ahead and knock on the door for the patient's room after I have all my supplies. Enter the room, close the door, hand hygiene, introduce myself. Hello, my name is Madi. Today I'm gonna be your nurse and I'm going to be injecting morphine for you. Can I please have your first name, your last name, and your date of birth? Thank you, Ms. Tupo. I'm going to go ahead and make sure that the patient's ID band is correct. Yes. Do you have any known allergies? No? Okay. Perfect. Have you had morphine before? Yes. Okay. Even though you did have morphine before, I just want to let you know this is an opioid to relieve pain. There are some common side effects. Common side effects would be like drowsiness and lightheadedness. But if you have any of these adverse side effects that I'm about to mention, such as like confusion and hallucinating, or if you start having a hard time with breathing, whether it's breathing too quickly or breathing too shallow, you let me know or call our clinic or call somebody right away, okay? Okay, so now I'm gonna go ahead and get the medication ready. I'm gonna make sure I have the right medication again. Perfect, I have morphine. I'm gonna go ahead and hand hygiene and then put on my gloves. Okay, so this injection is going to be going into intramuscular. We have a couple of places that this can go. This can go ventral gluteal, or this can go in your arm. Do you prefer the arm? Okay, perfect. So I'm going to be going on your acromion process. I'm going to be going 3 fingers down from the acromion process, making sure I have the deltoid muscle going 90-degree angle in there. I'm going to go ahead and open up my prep pad, my alcohol pad. I'm going to wipe this off, toss that. Oops. Toss that. While that is drying, I'm going to go ahead and open up my syringe and get my needle ready. That, toss that, like that, and then I'm going to inject the air to 1.5. Okay. Perfect. So now I'm gonna go ahead and uncap this. Inject the air into the medication. Going to invert. Okay. I'm going to go ahead and take this out. I'm going to recap this by the scoop method. And then once it's scooped back in, I'm going to go ahead and close it up. Make sure that there are no air bubbles. Perfect, there are no air bubbles. Okay, now I'm gonna go ahead and put this down. And then I'm going to make sure that the patient's arm doesn't have any bruising, swelling, edema, scarring, where it's going to make me not have a great injection. Okay, perfect. Patient is good to go. Going to go ahead and locate my spot and then clean the site. Perfect. Okay, and now with this one, we do aspirate. So you might feel slight burning and slight stinging. It might feel like there's something in your arm, but just go ahead and talk to me and we can get this show on the road, okay? Okay, I'm gonna go ahead and uncap now. And I'm gonna make sure my bevel is up. I'm gonna inject at a 90-degree angle while squeezing the patient's arm and talking to the patient. I'm going to insert and then I'm going to aspirate, okay. And now I'm going to inject slowly. Okay, perfect. So now I'm gonna go ahead and grab a tissue. I'm going to, and then I would cap it and throw it into my sharps container. And then I will go ahead and just apply a little bit of pressure. Now that there's enough pressure, I'm gonna go ahead and take off the gauze, apply a Band-Aid if needed. I'm going to ask the patient, are you comfortable? I'm going to pick up all my supplies, and then I'm going to take off my gloves, and I'm going to hand hygiene and document the procedure, and good to go.